Fertility Talk Show with Dr. Love. We are having our Christmas edition, and today we are at St. William's Specialist Hospital. We are having our guest speaker today in the person of Dr. Mube Williams. Good afternoon, Chief.
Yeah, good afternoon, Dr. Grace. It's nice to be with you.
You can say that again.
On your December's edition of your talk show.
Thank you very much.
Yeah.
Backstory: Dr. Mube was once my colleague some years back. We used to work together in one small funny hospital back then.
Yeah.
And today he's the Chief Medical Director of St. William's Specialist Hospital here at Shumosi in Port Harcourt, Rivers State. Thank you very much, sir, for having us on this show and for taking out some time to talk to us despite your very busy schedule. Today on the show, we are talking about a very interesting topic. You know, we always bring you the best, spiciest gist when it comes to fertility health. And I'm sure this is something that many people want to know more about. It is the million-dollar question on every trying to conceive parent's mind. Why is IVF so expensive? Chief, that is the million-dollar question we have for you today. And it's something that has been, you know, out there a lot. We see people doing our counseling sessions. Some years back, we had issues with people accepting to do IVF. So they were still very skeptical about the procedure, test tube baby, is the baby going to be okay and all of that. But years down the line, we have seen so many results. People are having beautiful children, healthy children. So that problem is out of the line. Yeah. The next problem is finance. So we have a lot of people willing, intending with their full chest, wanting to do the IVF, but the problem is the cost. And we have people ask us this question all the time. Doctor, why is it so expensive? I want to do it too, but I don't have the money. And we have brought it to your table today so that we can hear from the horse's mouth, somebody who is right there in practice, doing it every day. Throw light to us as to why IVF is so expensive.
Okay, thank you, Dr. Joe. And once again, I would say I'm very pleased to be with you in this edition. I love helping women get pregnant. So anything that has to do with fertility, women getting pregnant, always feel free to call Dr. Mube, and I'll be there. Okay. Well, IVF, as we know, is in vitro fertilization. Yes. And for every time or any time humans want to manipulate nature to achieve their desire, it means they are going from the natural way to get it artificial. Okay. And you know, the Holy Book, you know, told us that we'd have wisdom and even do greater things than, you know, the Lord Jesus Christ has done. And I mean, we have knowledge and God is helping us. Okay. Now, the IVF idea, the concept, the technique is a foreign technique. Okay. And it ranges from the process of where you cancel your patient to the point where you would naturally mutilate the female egg production. Okay. Normally, the female ovulates, just one egg is extruded per menstrual cycle. Okay. But for the IVF, we try to stimulate to get as much as 15 to 20, 30 eggs as much as possible. Okay. To help us produce as many embryos from which we can choose the most suitable one. Okay. So the proper process has to do with giving injections. Those drugs are very expensive because they are foreign sorted. They are drugs that are not produced within Nigeria. Okay. And you know, unfortunately, with the Naira-dollar relationship, anything that comes outside the shore of Nigeria is very, very expensive. Okay. Then after giving the injections, we go to the theater, first phase of theater. Okay. So we go in to retrieve those eggs, a surgical procedure to retrieve the eggs, during which the patient is given drugs to make her not feel pains, mild sedations, and the eggs are collected. Okay. Then these eggs are then used with the sperm of the husband, and fertilization is, you know, achieved. Okay. And these babies are then incubated in an environment that is prepared like a human body, an artificial incubator. Okay. So the babies are grown from day 1, day 2, day 3. I mean, sometimes even day 5. Wow. So you imagine creating an artificial human body to grow these embryos. Okay. Then the next phase of theater procedure is taking the woman back to theater to transfer those babies into it. You agree with me that ranging from the drugs that we use to produce plenty of eggs to the media that we use to incubate and ensure that the embryo grows
Okay.
to the incubator itself.
Okay.
These are
So you're talking about
expensive.
power all through.
And you must have power all through all 5 days for this procedure.
With or without NEPA, of
With
course.
or without NEPA. Obviously, we don't do NEPA. This
Yes.
is solar.
Okay.
So it's going to be either solar or the
Or
big
generator.
generator. And that's how it goes for the whole 5 days. So you're considering power, you're considering drugs, you're also considering the theater procedure. So you have a whole lot of personnel involved. You have your clinician, you have your clinical
Embryologist.
you have your clinical embryologist, you have your guidance counselor, you have the nurses, you have the anesthetics, and a whole wide range of personnel involved in this. And of course, they are going to be paid for their services. So all of this sums up to why IVF is expensive. I want to believe that in the nearest future, we'll be having Nigerian companies that can produce these drugs.
Okay.
And if we can achieve that, that will drastically reduce the cost of IVF.
IVF.
Yes. And to make issues worse, the equipment used in IVF are very, very expensive. They run into hundreds of millions. You know. So I mean, in other reasonable countries, government supports investors that do this. But unfortunately, we go to bank, we take loan, I mean, with very high interest rate and the rest of it. So these are the whole sums. We understand that it's expensive, but unfortunately, we can't do so much. And that's why periodically, I mean, facilities, I mean, like ours, we do promos to help, you know, give room for those that can't pay as much as the normal cost is. And I mean, that's just.
Wow, thank you very much, sir. So it's literally self-explanatory, from the cost of drugs to the cost of reagent, culture media, to the cost of power. That's a load on its own. We know what diesel is like now, or even if you're going to use solar, we know what it means to set up a solar system that would power an incubator. And we're talking about uninterrupted power supply for 5 days. And this is for one patient.
Just one.
So just like that, if it keeps running, so continuously, you just keep running cycle after cycle after cycle. And this has to be done top notch so that you can get the desired results. That makes a lot of sense. And you said something that's very key. Out there in other better developed countries, I will not say we are undeveloped, but let's say better developed countries, we have governments coming in to subsidize IVF for maybe government workers or individuals. It is in part of a lot of HMOs, you know, and things like that. There's support generally for people who are trying to grow their families, but we don't have things like that down here in Nigeria, and it makes the process very frustrating to know that every parent who wants to go through this route to increase their family size will have to pay completely out of pocket. And that is something that is almost unfair or heartbreaking, because many of these people did not wish this situation on themselves. It's not necessarily about something they did or did not do. It's just what life has thrown at them. We're going to take a break now. When we come back, we'll continue with our discussion. Don't go anywhere. Welcome back. If you are just joining us, we are having the Fertility Talk Show with Dr. Love, and today we have our guest speaker in the person of Dr. Mube Williams. He's the Chief Medical Director of St. William's Specialist Hospital, Rumosi, Port Harcourt, Rivers State. Thank you again, Chief.
Thank you.
And we have been talking about the costs of IVF, why IVF is so expensive. And Dr. Williams here have been able to tell us the nitty-gritty of what emanates to produce whatever we know as the cost for IVF, talking about the type of drugs used, how they are sourced from outside the country, to the procedure itself. The entire IVF process has about 2 theater sessions, and then the different personnel that are involved in the entire procedure, and then the equipment being used, culture media, all of that sums up to give a very high cost for the overall procedure. And unfortunately, here in this part of the world, we do not necessarily have support, maybe from government parastatals or even our NHIS, as it were, to support fertility treatment, which is, well, not a very pleasant news. But we are hopeful that maybe in the nearest future, when IVF drugs are being produced here, or possibly when we start getting some of these reagents and equipment sourced within the country, it will become easier to do IVF and probably cheaper to do IVF in Nigeria. And so we'll continue with our questions. So Chief, yes, thank you for that wonderful breakdown and explanation as to why IVF is expensive. However, there are people who still need to increase their family size. Yeah. There are people who are still struggling with having, even if it is just one of their own. I know that here in Nigeria we are very interested in population control. We are still a lot of people, and maybe there is not so much interest as to people increasing the number of our population. But like you and I know, you are in the field. There are people who are desperate to have, even if it is one of their own. And I believe that every family, it is like a human right for every family to have at least one child. Yes. Yeah. What is your advice for such couples? They cannot just afford it offhand, as it were. There are some people that can afford it, yes, but the bulk of the population who needs this treatment cannot afford it off the top of their list. Yeah. What is your advice as a clinician, as a parent, as a friend, brother, whatever? What is your advice to such couples?
You know, I mean, Nigeria, as we know, belongs to the infertility belt.
Okay.
Yeah, and the countries within this infertility belt seem to have high prevalence of infertility.
Yes.
And unfortunately, based on our culture, our stronghold or religion, there's a high premium placed on childbirth.
Thank you.
I mean, for several reasons. For the reasons of inheritance, having someone to bear your name, having children to take over your property, and a whole lot of things.
We
and
love
because
children.
of this, yes, and because of this, I mean, even if the country is very populated, people still want to have offsprings of their own.
Yes.
You know, for those that have these infertility issues, the first point of call is see a fertility expert.
Okay.
Yeah, see a fertility expert who would take histories from you, do some basic investigation, possibly ultrasound scan and some blood tests to ascertain what is the cause of the infertility.
Okay.
And from there, I mean, the treatment can be simple, have regular intercourse.
Okay.
It can go up to ovulation induction.
Okay.
We can also move up to IUI.
Okay.
Before you now start talking about IVF.
Okay, so Chief, let me stop you. This is very key because what you have described now, it means that not all fertility treatment is that expensive.
Yes.
And unfortunately, there is this, how will I call it, is it a mindset or a bias amongst people, especially people who are struggling with fertility challenges, that everything that has to do with fertility issues has to end up with IVF.
No,
so you're telling us now that that is not correct.
That's
that is
not correct.
That is a misconception.
Yes.
And that the first thing to know is what is even wrong.
Apparently.
And there are many methods of treatment that doesn't necessarily have to get to IVF.
Apparently.
This is very key. This is very, very important for us to note. Okay.
Yeah, so I mean, if all of these, other phases doesn't work, they will move up to the big boy, which is the IVF.
IVF, yes.
Yes, and in the IVF, I mean, we understand the challenges in getting funds for this.
Yes.
We understand the psychology that has to do with this.
Okay.
And that's why some fertility centers accept bit by bit payment.
Okay.
Yeah, so I mean, while you're making your payments, they are also doing a few treatments to get you prepared.
Okay.
So that by the time the payment is completed, we hit the ground running.
Okay, so on the average, sorry to cut you, on the average, how long, what's the leeway for these bit by bit payments?
Well,
what we love to call pay small scheme in Nigeria.
Well, it depends on the facility.
Okay.
And it also depends on the program they are running at that time.
Okay.
Yeah, but I assure you, a whole lot of centers give room for that.
I'm beginning to give room for that.
Yes,
okay,
because,
that's very useful information.
Yeah, because we understand the economic realities of ground. Yeah.
Okay.
So that's it. Then outside that, people already join fertility groups.
Okay.
Where they pool funds together.
Okay.
Just like an akawo team. So they know that fertility treatment is,
It's expensive.
let's say is 1 naira.
Okay.
So they say this month we are pulling funds to give for you to do your school. And the other month, the other person. And it goes round. You know, Nigerians are very smart and intelligent people. So they have a way of always trying to go around their problems.
Yes.
And then again, like I mentioned, several centers periodically try to give back to the society and do promos just like we're doing. The whole essence is to contribute our quota to the society and also help those that can't afford, you know, as much as the normal cost will be. But the first thing is see a fertility expert and ascertain what is your problem and how best to manage it.
Okay, thank you very much for those very insightful ideas that can help every couple trying to conceive to at least start from somewhere. Thank you very much. So, and we got news. A little bird told us that something is happening in St. William's Specialist Hospital with regards to giving back to society, doing end of year Christmas giveaways, as it were, and helping, like you have mentioned, those who probably might not have all the funds immediately on ground, but are still interested in improving their family size. Can you please throw more light on that and tell us about it?
Yes, I mean, you got the information rightly, and I must tell you, giving back to the society is one of the things we do in St. William's Specialist Hospital. I'll tell you for free that we've operated more than 100 patients here under our periodic free medical outreach program. I mean major surgeries such as fibroid surgeries, very huge hernias. I mean a whole lot of surgeries. I will do it. We'll do it periodically. We'll do it almost at the end of every year. I mean, but for this year, we're looking at fertility because that's the main thing. You know, so and that's the main thing. So for this year we're doing subsidized IVF
treatments,
discounted IVF treatments. And I'm sure the cost and every of the details is on our flyers. I assure you won't have that kind of amount for the IVF anywhere around. And like you know, we have very wonderful team, very wonderful technology, and I'm sure with all of this, any person that taps into this can achieve their fertility desire. So, I mean, maximize the opportunity before we get to 31st of December.
So this beautiful offer is till the 31st of December 2025. Guys, I kid you not, it is a juicy offer. I have seen it myself. I've seen the flyers, and you really cannot get this price anywhere else. So rush down to St. William's if you are interested in having your IVF procedure. There are many people who know that it's IVF that they're going for. They've done the preliminaries, they've seen doctors and everything, and they know that IVF is the thing for them, is the solution for them. This is a wonderful opportunity. We want to first of all say thank you, because it's not easy. There are so many centers. It's not all the centers that are doing this. So to have that heart of giving, first of all, is a wonderful thing. It's not just because it's a publicity stunt, as it were, because at the end of the day, the figures matter. Yes, and it's going to take something out of you, and we want to really appreciate that. We are an organization that really have the heart for people wanting to conceive, and that was part of your opening statement. Everything about getting women to have their children is what you're passionate about, and it is reflective in this kind of literal giveaway that you are doing in terms of this discounted IVF treatment for the end of this year. So we say thank you very much for that, and we believe that wherever the resources is coming from to make up whatever you're going to be doing this year, God will replenish it 100-fold in Jesus' name.
Thank you.
So thank you very much for having us today. Like you have heard it, guys, this is a wonderful opportunity that I would not advise anyone to miss. We'll be talking more about it on all our platforms, and we hope that as many people as are interested can key in. You can reach us on all our social media handles on Facebook, Instagram, YouTube, TikTok at Love Foundation, and you can send us WhatsApp messages on 081 75629 809. I'll take that again, 081 75629 809, and we'll be able to guide you on how to be part of this promo. Thank you again, Dr. Williams. We're glad that we had this conversation with you, and we hope to see more of you as more patients come to access care.
Okay, thank you for your passion.
Thank you.
Thanks for all you do for women.
Thank you.
I'm always interested in anything that has to do with women getting pregnant.
Yes, thank you very much.
I mean, like, you know, we also do an online consultation.
Okay.
Yeah. So,
oh, really?
Yeah, we do online consultation. So they can
so
feel
people
free
from out of state?
Yeah, they can feel free to book an online consultation with us. Yeah.
Okay.
And I know we'll do justice to
Okay,
that.
that's excellent. Thank you very much. So guys, until we come your way again, this time it will be in January with another interesting topic. We are saying Merry Christmas and a Happy New Year to you all. Bye-bye.
Happy New Year.